So we're going to move on to facials. Facials is a brilliant unit to do. It's so relaxing and it's really good for your skin. Now, lots of people think facials is a luxury treatment. It's something to go for a treat. But also you've got them clients who do suffer from skin conditions such as acne, they have really dry skin, or they want to improve their aging. And these are the clients that you need to look at this as if going to the dentist. It's an appointment, you're improving and you're maintaining your skin. And you need regular checkups for that. These clients will see benefits when they return to you regularly. So a facial consists of not just a cleanse, but you get your cleanse, you get your tone, you can incorporate steam and you incorporate massage. And your client is laying in the bed all wrapped up and all cocooned in. Yes, a facial needs to be relaxing, but you also need to make sure with your facials they are effective and meeting your client's needs and skin conditions. You might find your client will fall asleep in the treatment and they will go into a deep sense of relaxation. You find that some therapists will really just focus their career on being a facialist. And facials do vary depending on the area. So they can vary from £25 all the way to £200, depending again if you're in London, Essex, if you're in a spa, if you're in a salon, and what products you're using. When looking at this unit, we're really focusing on improving the skin condition. We're not just going to be looking at skin conditions, we're going to be looking at age groups, skin types, and how we have to adapt our products and service for them needs. You tend to find a facial is normally an hour. Again, they vary from an hour to an hour and a half, and sometimes you get quick express facials to 30 minutes. Each facial will always consist of cleanse, tone, and moisturise. And that would be your basic facial. And then from there, you then get your luxury where they add in things such as your steam, exfoliation, mask, and massage. We're going to familiarise ourselves with some of the words that you will tend to find that come up in your facials. Now we've got that word erythema. You may have heard me speak about it before. And this is the redness on your skin. This is when your blood rises to the surface due to the increase of blood circulation. Now this is expected, especially in a facial, you'd expect redness, so please don't panic. And a word I just want to familiarise you with that you will tend to find in your exams or you tend to find in any A&P aspect when it comes to erythema and blood circulation is the word vasodilation. And that just means your blood vessels widening. What does astringent mean? Astringent means a product normally we find in a toner, and it has the sort of effect of constricting, tightening. So we wouldn't tend to use these products on anyone with sensitive skin. We try and avoid that. But anyone with oily skin, these products are really good for. Hypoallergenic. Hypoallergenic doesn't mean that they're not going to cause any allergies at all. What it does mean is that brand or the person making it has ensured that the ingredients that are used are going to reduce chances of an allergy occurring. Hyperallergenic. So remember, you've got hypo, what I've just spoke about, and then we've got a hyper. Hyperallergenic is when someone is really allergic to everything. So they've got super sensitive skin. And desquamation. Again, you might have heard this word, but if you haven't, it just means our natural processes of exfoliation. When we're removing the dead skin cells from our skin and replacing them with new fresh cells, nice and healthy. So as you can see, we've got a list of all the products that we're going to use in a facial. And I'm going to start off with the eye cleanser. Now it's really important we use an eye cleanser and not just a normal cleanser, especially for us ladies that wear mascara. These are normally more oily based than a normal cleanser, and they're going to be much safer to use on the eyes, so you won't get any stinging. They're also going to be kinder to your lashes as well. So an eye cleanser is super important to use before you complete your cleanse. Moving down to the next product, this is our cleanser. Now cleansers come in all forms. We've got oily cleansers, balms, foam, cream. And depending on the skin type you are will depend what type of cleanser you use. But cleansers are super important to put into your daily routine. It will really help and you'll really notice the benefits as you get older. Looking after your skin is really going to help with reducing the aging effects. Now the purpose of a cleanser is to lift all the oils, to lift all the dirt. Now if you start using more expensive brands, you will find that you need to do 2 types of cleanses. You normally have your first cleanse and then your second cleanse. I will then go through this a little bit more further into this unit. The next product is a toner. Again, you can find different types of toners. You can find spray toners, ones we put on cotton pads. These toners are really good to lift up any excess dirt or bacteria, as well as any excess products. Like we said before with astringent, you'll find that toners are astringent, so they have that tightening effect and they really refresh your skin. An exfoliator. These come in a variety of ranges as well. You have your really soft exfoliators that you can't really find any grains in them. You then use some other exfoliators that have more grains that you can find that will really lift that dirt up. So depending on your skin type and sensitivity on your skin will depend on the type of exfoliator you use. The purpose of exfoliator is really important because that really helps increase your cell renewal. Bring them dead skin cells up to the surface, remove them, and then what comes up to the surface is your fresh, clean, plump cells, which is going to give you that glow that's really going to help with your anti-aging, and it's going to give you that fresh, plump look that we want on our skin. Moisturisers. There is a vast range of moisturisers out in the market, and it's just depending on what ones you like. You have your thinner consistencies, your thicker consistencies, you have your plain smelling ones that don't really have any fragrance, and then you've got ones with fragrances in it. Then you just got to be careful which ones you're using depending on your skin type. There's lots of organic products out there now, lots of vegan products, lots of ones that are going to be that have all them fresh ingredients in them too, and some people don't like all them smells, so you've got your plain ones. Now moisturisers should be only used in the day. Again, some companies will ask you to use it day and night. It depends what companies you go with. Again, it depends on what brand you are with, but if you need to use it in the night, then absolutely. But the purpose of a moisturiser is to keep your skin hydrated, keep it moisturised, and keep it looking fresh. If, however, you use a company brand that doesn't use a moisturiser at night, you tend to replace with a serum. And the reason why they ask you to use a serum is because it's lighter and it's more concentrated. And this is when your skin really repairs in the evening. So when you use a serum, it's lighter, you go to bed, it has that time to repair, and it's not so thick and clogging up your pores. You can see we've got eye creams now. Now, a lot of people will bring their moisturiser right up to their eyes. Now, the reason we have eye creams is because actually our pores around our eyes are around about 6 times smaller. So when we're using products with bigger particles, these creams can't penetrate through. So when you are using your moisturiser, around your eye area won't see the benefits. And if you realise that actually eye creams are a lot thinner in consistency, now this allows your skin to absorb this product a lot better. The product is specific for your eyes, so it's really going to work on them areas like your crow's feet, your anti-aging, making sure your eyes circulation is good as well. So eye creams are just used underneath the eye and around the top area. And if you remember from the muscle video, this is your orbicularis oculi. So the next one is skin warming devices. So this can be your steamer, or you can use hot towels. Now this heats up your skin, and especially if a client has milia, this helps soften that area so you can remove milia easily. It also helps soften your pores, so extraction's a lot easier. So anyone with lots of blackheads or blocked pores. And it's also great for your circulation. The heat stimulates blood circulation around your body, bringing that oxygen nutrients up to the surface and giving you that healthy sort of glow that you always want with the facial. Facial masks. Again, like your moisturisers, like your cleansers, there's a variety of different masks that have different benefits and effects. So again, if you've got oily skin, you'll tend to find you have them drying masks. If you've got dry skin, you have them deep moisturising masks that are non-setting. Now masks are used as an extra to a treatment, so you will use these more in your luxury services. And they give an extra boost to your facial. So just a little extra boost that maybe your moisturiser wouldn't give. The type of mask you will use will depend on your findings during your skin analysis. So we're going to look at our facial routine, and we've just bullet pointed each of the steps for you. We would start off with the eye cleanse, where you'd pop the product onto the cotton pad and you would sweep downwards over the eyes. Now the reason for this is so you don't break any lashes. You then would do a lip cleanse, making sure all lipstick is off the client's lips. And then you would start off with your first cleanse. So as you can see, with our first cleanse, we complete this a little bit faster than your second cleanse. Now our first cleanse is called our superficial cleanse, and we go over the décolleté, up the neck and around the face, and you stop at the temples. Now with your first cleanse, this is lifting up any dirt, and you tend to use a cleanser that is all for all skin types. Now during your skin analysis, you're going to be looking at the skin, feeling it and asking questions. Now later on at the end of this unit, we're going to talk about skin analysis, so you will have a deeper understanding of it. Moving down to your deep cleanse, you will complete the same process. So over the décolleté, over the neck, around the bottom of the face, and then round the cheeks, through the middle of the eyebrows and finishing over the forehead and temples. You complete circular movements for this, as well as your sweeping movements. Now this is where you would pick your specific cleanser for your specific skin type, whether that was your oily, dry or sensitive or mature skin. You will do this a lot slower, because this makes sure this cleanser here is specific to your client's needs. After your deep cleanse, you're then going to tone the skin. This just removes any excess products that's left over or any residue. We're then going to complete an exfoliation. Now again, it's the same process. You apply your product into your hands. Make sure you rub it to get the temperature so it's not freezing cold on your client. You go over the décolleté, up the neck and around the face, all using your sweeping and circular movements. You want to make sure that you're getting in between all of your nose cracks there, because that's where dirt can build up. And we're lifting all of that dirt and dead skin. You would then remove with sponges. Some companies would use hot muslin cloths or hot towels. The next step is steam. So I'm just going to jump back a little bit there. When you do start your exfoliation and you are completing the steam within your facial, that's when you pop your steamer on, just so the timing works out really well. So by the time you finish your exfoliation, steam is then coming out. So you're just going to apply the steam on the face. Always, for health and safety, have your steamer facing away from your clients. When it first comes out, if there's any spits or if it's too hot, you're not going to burn your client. Once it's come out, you then have a little feel for yourself. You then turn the head around so the steam is then facing your client. You need to make sure that it is at a distance. You don't want it right over the face. And what you then do is bring it closer to your client, but ensuring that it's not directly on top. You would leave the steamer on between 3 to 10 minutes, depending on your skin type. Sensitive being the least time, and then oily, possibly dry, being the longest time. After steam, we would complete extraction. Now extraction will only be used if they need it. Please don't use this method if the client doesn't need it. And this is when they have lots of comedones. And if you don't know what comedones are, it's another word for blackheads. When extracting, you need to make sure you're wearing some gloves. You wrap the tissue on and you pull your skin apart and you wiggle. You don't ever go directly in, because that's when you can cause broken capillaries and hurt your client. You would then tone the skin again, removing any excess products and residue, and going to the next stage by blotting the skin and making sure the skin is now dry. You're then going to reach for your massage cream. Now, as you can see, we're going to make sure we've got lots of massage cream on our hands. We're going to heat it up so it's not cold on your client. And we're going to use some effleurage movements. And we're going to start with the décolleté. So we're going to go over the décolleté, over the shoulders and around the back. We apply lots of different movements from petrissage. So this is your circular movements. This is also your when you apply pressure with your thumbs. And you can also do movements to help with your toning. And this movement's really going to help with anyone who's worried about toning of their skin. Massage is the point of relaxation, so you need to make sure you're applying nice pressure, it's at a slow pace, and you complete this over the whole face, shoulders, and always make sure you're coming up to the neck and going into your occipital hollow. After around 15 minutes of massage, you then apply the mask. You'd make sure you'd apply this around the whole face, down the neck, and on the décolleté area. You apply this with a brush, and you would leave it for around 5 to 10 minutes depending on your skin type. You would then remove with hot towels or wet sponges. Make sure when you're applying the mask that you apply some wet cotton pads over the eyes, and during this time, which is really nice to add into your facials, add a hand massage or a foot massage or even a head massage. After the application of mask, you would then clean the skin and then tone the face, again removing any residue. You would then moisturise the skin all over the décolleté, up the neck and over the face. Always make sure you might have an SPF in there. It's really important your clients know about SPF, as well as making sure your products maybe contain them. Make sure when applying your moisturiser you don't go to the eye area, because that's when you apply your eye cream. Once finished, you then complete your client record card and discuss your aftercare with your client. So general questions asked. So we've listed a few of them on our PowerPoint for you. These are the most common ones that our clients will ask us. So the first one is, how would your client take care of their skin? Now that's really simple by just doing a few simple steps, and that's your cleanse, tone and moisturise. Cleansing and moisturising is the most important one, but if your client can fit in the tone, definitely recommend that. And they need to make sure they do that every day, and they shouldn't go to bed with any makeup on. How would you get your client to care for their skin on a weekly basis? So complete the steps as question 1, but also incorporating your exfoliation and applying a mask. Depending on their skin type will depend how many times you ask them to do that, but at least 2 to 3 times a week for exfoliation and once a week for mask. How would you take in consideration for the different skin types? Now, when you're a beauty therapist, you need to make sure that you're aware of the products you're using, because you want to be recommending the right products for your clients. So you need to know the ingredients used, how that product works for that specific skin type, and how it will benefit them. How can you prevent premature aging? Avoiding sunbeds, wearing your SPF, making sure you've got a really good skin routine, moisturising, exfoliation, and having a good diet with plenty of water. How can you prevent dehydration? Avoiding our coffees in the morning, but drinking plenty of water, making sure you're hydrating yourself constantly. How can you aid oily skin? Now, I'm going to tell you a little myth. People think when you use oily products, you get more oily skin. Well, actually, when you're using stripping products, your skin then goes into a state where they're like, oh, we're not producing enough oils, so they produce more. So you need to find a oil-friendly moisturiser and cleanser. Definitely use a toner, but don't use stripping products, and that's going to be important to maintain your oil balance. Another thing a lot of companies you will see, they like using an oily cleanser for oily skins, because natural oils lift a lot easier. Avoiding oily foods though, so like your chips and fast foods, this will help maintain your oiliness as well. How would you provide a facial for a male client? So those men that have beards, you definitely wouldn't use cotton wool because it will get stuck to their beards. There's now lots of products for men, so do consider around the bearded area. So again, depending on the product and brand you're trained in, you might still be able to do that. However, try and avoid that area, especially with exfoliation, especially if it's beaded as well, because they will all get stuck in around the hairs. If they're clean shaven, sometimes you find they have rashes and they're quite sore, so avoid exfoliation or any really heated treatments around there, and use more sensitive products for around that area. You will also find that for a facial, men would like deeper pressure on the massage, and their pores tend to be larger and they tend to suffer more with comedones, blackheads. Facial masks, I mentioned them earlier. Just to clarify from this PowerPoint, we have our set-in and non-set-in. So setting means that's like drying, that's when it's drawing out. We tend to find people with oily skin or congested skin will really benefit from setting masks, so they're your clay based. Then you've got your non-setting, which is more moisturiser, oily based, and this is for any people with dry skin or needs moisturising or ageing. You can also find gels as well, so you get like your gel masks. All of these are just a really good one to add into your skin routine. They just intensify all your products. So for your qualification for VTCT, you do need to have an awareness of the following masks. Now, we won't be using them probably in your salon. I've not seen them used now. However, you do need to be aware of these. And listed in the table, you can see we have a variety of different ingredients for different skin types. Now, if you mix it up with your orange water, rose water, these turn into your setting masks. And if you mix it with your glycerol, this becomes your non-setting. Massage mediums. So massage mediums come in creams and oils. Creams is the most popular one because people have a fear of putting oil on their face, but especially now we've developed some really good oils that won't cause extra spots, rashes or anything like that people normally had reservations about. They've got a lot better. But you need a massage medium for your massage, and that gives you your slip and glide. When you use an oil massage medium, this is for someone who has sensitive skin, oily skin or combination. You would use a cream if someone had dry skin, again sensitive and mature. Both will have that nice slip and glide around the skin but won't leave your skin feeling oily. Now moving on to skin mapping. Now skin mapping is when we do our skin analysis, as I mentioned earlier in our routine. Now there's lots of different types of skin mapping. From if you go on the internet, you can see the ones from Dermalogica are slightly different to another company. Here's one that I found that was just generally for like covered most of also all the companies. Now with your skin analysis, this is really important. Your client has come to you to find out about their skin. You just saying, oh, I can see you've got a few lines, oh, it feels quite good, your skin, is not what your client's looking for. What they want to be taught, they want to be educated about their skin, and that's your job. So looking at the lady behind me in the diagram, we're going to start off with the forehead. So as you can see on the forehead, this is connected to our bladder. Now, it doesn't mean everything is external. This is looking for you internally. So if you're finding you've got rashes and spots on your forehead, it could mean that you're not drinking enough water. You might have a urinary infection, or something could be going on inside regarding your urinary system. So these are some of the questions you're asking. Are you drinking enough water? Have you been hydrating yourself enough? These questions here, you're going to be asking your client, as this will allow you to get a better idea of what they've been doing in their lifestyle. Moving down to the nose. As you can see, it's connected to your heart. That doesn't mean anything really terrible. It could mean that you're exercising more than you normally are. It could mean that you've got asthma. It could mean that you started smoking, you stopped smoking, anything like that. You could be asking your clients as well. This will determine if you've got any redness around the area, or if you're finding you're getting more spots or congestion. Moving down to our cheeks, we can see it's a combination of our heart, colon and lungs. Now again, linking in with the smoking, if you've got lots of spots around your cheeks, this could be connected to you smoking. It could be that you, again, suffer from asthma. It could be you've been around people that smoked. It could be you're going now travelling on the underground where you haven't done before, or living more in a congested area. You could find rashes and more comedones and more spots appear on your cheek area. Moving on to our eye area, this is connected to our stomach, kidney and liver. So we could find that we are not digesting our food properly, we've changed our diet, we're going through a detox, we're cleansing. Again, we could find the rashes or any problems around our eye could be linked to that. Moving down to this area here, you've got your colon, but also you can find that it's all linked to your hormones. So again, especially ladies that are due on, we tend to find we get a lot of spots come around these areas here. or if we're finding that we're more stressed or we're not sleeping. This is all stress related around your mouth area too. Now you're going to use the skin analysis, face mapping, alongside your external checks. So you're going to be asking these questions to find out if anything's going on internally that's causing any of these skin problems and conditions, as well as feeling and looking. So you're going to be asking your usual questions about, do you cleanse, do you exfoliate, do you drink enough water, feeling the elasticity of the skin, pushing it together, seeing how quickly your skin bounces back and them lines disappear. From here, you're able to identify, is it something more internally we need to be focusing on, or is it externally? And again, this helps determine what type of skin type they are. If they're sensitive, you're going to find more redness. If they're oily, you're going to find more oils on their skin, as well as larger pores and comedones. If they're dry, it's going to feel rougher, it's going to be dull. And if they're mature or they're worrying about aging, you're going to find that they're going to have less muscle tone and elasticity. Their skin might feel thinner in areas too, such as the eye area. Now finishing up for my facials, we're going to just look at aftercare. Aftercare, like anything, should be related to your client specifically. So if your client has skin conditions that really need to be focused on, I would really recommend them coming in once or twice a week. If their skin is manageable, they just need a few areas to look at, 2 to 3 weeks. And if they've got really good skin and they're just coming into maintaining, every 4 weeks. You need to make sure you're telling your client to cleanse regularly, every day, day and night if possible, and to moisturise or use a serum. Moisturiser in the morning, serum in the evening. To follow a really good diet. And if you've got clients that say, I can't eat my vegetables, I can't eat my fruit, recommend them a supplement. Drink plenty of water, exercising, and making sure that you are wearing an SPF. And even if you are a client that doesn't feel like they need to wear an SPF, it is really important you wear something, because them effects will occur later on in life.